Hello, my name is Jalen Jones, digital producer here at WRAL, here to catch you up on the latest of the UNC Health Cigna contract disputes. We want to get you caught up on the latest in July 2025. UNC Health told WRAL, unfortunately, Cigna is not willing to engage in meaningful discussions or commit to patient care that UNC Health requires. Now, later in the year, November 2025, UNC Health also said in a statement that we reached out to them for, unfortunately, progress has been difficult. It's increasingly likely that as of December 1st, UNC Health hospitals, clinics, and providers will be out of network for Cigna members. That will mean higher costs and disruption for Cigna patients. It is now December 5th as I'm recording this, and there is still no deal done. UNC Health also says in a statement, we've been negotiating with Cigna on a new agreement that's consistent with our relationships with other insurance plans and supports the high quality care that patients deserve. That remains our goal. WRAL emailed questions to Cigna about the status of negotiations, right? The barriers preventing a new contract and any guidance for users on continuity of care. Cigna responded by saying this: negotiations are moving forward in good faith with UNC Health to reach a fair and reasonable agreement for all. Now, let's focus on the consumer aspects of this, as both sides of the insurance companies and hospital systems are trying to fight for the best deal for their respective parties. UNC Health deals with about 65,000 Cigna members. More than 4,000 of those members had appointments in December 2025. WRAL has received tips from viewers, and here's one unnamed viewer that we're going to walk through real quick. They go to occupational therapy 1 to 2 times a week with a copay of $25. So if you're going one time, $25, 2 times, $50, and the budget is not the biggest of a hit if you're able to plan ahead. Now, as of December 1st, on that Monday, that will jump to $468 per visit. Their doctor visits will jump to $30 to $165 because they are out of network. Now, patients have said their doctors are calling ahead to either cancel appointments or warn them of those increased costs. Now, North Carolina Health Networks, we're talking about the big ones, Duke, Wake Med, UNC Health. They often, on their websites, they list the insurance companies that they have contracts with, and insurance plans are accepted at their facilities. But what we really don't know is how long those contracts last. They always announce when they start, we've renegotiated. We just don't know when they end. And that is a detriment to the consumer to plan ahead and fight for the best thing for continuity of care, which is what we said earlier. WR reporter Sean Gallagher has been on top of this for these past few weeks. Let's go to him so he can give us the latest on these Cigna UNC Health contract negotiations.
Over the last 2 weeks, I've reported on the ongoing negotiations between UNC Health and Cigna and the impacts it's having on patients. I've talked to everybody from those trying to get their routine physicals every year, all the way through to the more serious, the people in need of life-saving surgeries, and even some cancer survivors who depend on those doctors for care. But today, we're in the town of Apex, who's facing this head on. Largely in the town of Apex, 850 plus employees are all covered by Cigna here. It's why concern is so high every day there's no new deal, and why town leadership is pressuring Cigna and UNC Health to strike a new deal. Because if there's no new deal done by the time the calendar changes, the town may be changing its health insurance provider.
I'm reminding them that I have police officers, firefighters, members of our public works, electric utilities. These are real people that serve our community every day.
Are you guys leveraging the power that you have as a town to, try to at least have these voices be heard to get something done?
We are, and we had a meeting with Cigna last week, and they are very aware of our positioning in that relationship.
This is where things stand at the end of the first week of December 2025. For the latest on the UNC Cigna Health contract negotiations, please go to WRAL.com for the latest. We will keep you updated there. Also on all of our social media platforms, YouTube, Facebook, X, Instagram. We will keep you updated there.